First, is it okay for GPs to say they will see fewer patients amid a pay round protest? 0207 862 2222 is the number. Do call. 37,000 family doctors in England will today decide if they will take industrial action for the first time in 60 years. GPs could threaten to halve the number of patients they see each day to 25. They could also stop doing work beyond their contracts and ignore rationing restrictions by prescribing whatever's in the best interest of the patient. The chair of the British Medical Association's GP committee has said the protest is designed to bring the NHS to a standstill very quickly. They say the action is necessary as part of a row over funding. What do you think, Salma?
I'm going to say something controversial.
You're joking.
Which is, I think that the doctors have a right, GPs have a right to decide how they're going to see their patients and how many patients they're going to see. Right? They're professionals. They're professionals. They should be allowed to do that. They've been very stymied by the GP contract, in my personal view.
Right.
However, there is still a service that needs to be provided. And if that is the case, then we have to start thinking about where we're going to potentially have the blackouts and the black spots for where the collapse will come and the appointments that this potential strike action will affect. And I think the doctors have to think very carefully about their duty of care to their patients, not just about perhaps their salaries or money and investment, about what is going to happen downstream, what is going to happen to A&E. There are consequences to this. And the reason I start off by saying that the GPs are entitled is because there must be a way for the Health Secretary now, for Wes Streeting, to come to the table, find a solution that will satisfy those professionals on whom we depend to keep this system going.
Marina?
I agree with a lot that was said there, but actually I would say this is the GPs looking downstream, because the reason they are doing this is in protest to the state of the current landscape when it comes to general practitioners. So we have lost 2,000 GPs since 2010. We've got a rise in demand. We've got an ageing and ailing population, and what it's worked out as is with this all the funding cuts. If they've got 30p per patient per day, they're sometimes seeing up to 50 patients per day. And they've got, I think, per GP, you've got 2,300 patients. There's a mass exodus that's expected. There's more and more pressure. And this is them actually saying, we need to do something, because actually what's going to end up happening is, because we're seeing a collapse, we're going to end up with a two-tier system, which is what you've got in dentistry, where the NHS can't provide what it needs to, and so all the private firms step up, and actually people end up paying. So I think this is a painful approach, but it's a long-term approach.
Yeah, but if you're ill, you haven't got long-term. You can't be messing around like this.
But at the moment,
you've got to see a doctor.
So another reason they're doing this is because they're already seeing patient care is being compromised.
Yeah, but long-term, there may not be an NHS.
I think they know now.
I don't know if you can...
There is a Labour government, right? There is a Labour government who I think they're probably seeing as is more open to negotiation. We're seeing that with Wes Streeting already. And they are doing what they need to do to improve general practice for the long term.
But if you're confident that a Labour government is going to be more open, why are they balloting members now? The whole point is that if you have a Labour government, then you can go to the negotiating table and you can work out, the BMA can work out then, with this new open Labour government, how they want to resolve this.
I think genuinely think it's leverage.
The strategy in the NHS has always looked at how they're going to make the resources go further. The NHS, in real terms, is the only department that hasn't been cut. The demand is rising in the NHS massively. And so even if you have an exodus of doctors, people have been thinking about work plans, how to keep people in the NHS. Lots of Western liberal democracies are handling this not well, because A, they don't have an NHS, but also the pandemic has been terrible for all Western health systems. So I think let's be realistic here. Is there a way to give GPs something that they need that allows them to be more professional, but means that they're not stepping off and going to create more pressure on this massive backlog that we already have? Because as Jeremy says, people are ill now. People need help and support now. Taking this strike action is only going to compromise patients.
I mean, the great sort of, it's almost a comic thing at the centre of it, which is that GPs are saying, right, we're going to spend as long as we need to with patients now. That's going to cause a massive problem in the system. And we're also going to give patients the medications they want. And the idea that you'd think the system will be set up for that anyway. And if I need a 25-minute appointment...
So they're basically going to work to rule. They're saying they will see
Well, it's not
no
really work to rule. It's working around the patient.
They will, but they're saying they will see no more than 25 and they will cap it at 25 per day as opposed to, say, 50.
Yeah. So it's whether or not GPs have got any right to do this. Sharon in Staffordshire, what do you think?
Oh, good morning, Jeremy.
Morning.
Good morning, Salma, Marina. I just want to say that, do you know that the GP, they get funded for how many patients they've got on their book? So basically, if they've got 1,000 patients on their book and they only see 400 out of that, they still get paid for that 1,000 patients.
Yeah.
Now, I think it should be capped to how many patients they see per patient they see, to what they get paid. And I do think the GPs are a bit selfish and thinking about money. They don't care about the patients. They just think about how much money they can get in their pocket.
Stressful job, though, isn't it?
I don't think it's just that. I also think there is also, Sharon,
sorry, I'm a senior nurse. I retired, but I see the state that the NHS is in. I've worked in the hospital, and it's stressful. It's burnt out for the doctors and nurses in the hospital, and we don't moan like these GPs that only work, 4 or 5 days a week?
Well, yeah, I mean, I think there are a lot of part-time GPs. That's part of the problem, apparently. But I think it's tough. I think, Sharon, the problem with your system is if you say GPs are paid per patient they see, we're going to have our appointments going down to 3 minutes. Yeah. They're only 9 minutes at the moment.
Well, GP, why? Well, Jeremy, I'm not being funny. Why should they be paid for, like, if they've got 1,000 patients on their books and they only see 400 of them? Why should they be paid that? And they're still moaning about, this and that, we're not getting enough money, blah, blah, blah.
OK, Sharon, thank you so much. All the best to you. Sonia in Berkshire, hi.
Hi.
What do you think? GP's right to take this action?
No, I don't.
Why not?
No, I mean, what about the patient? I'm a patient. I'm actually 82 for 82.
22,
sorry.
I was going to say.
I've got Parkinson's.
Oh, okay.
And it's very difficult to get appointments. My doctor is a really lovely lady, but it's very difficult to get appointments. And last year, when I saw the consultant in November, they made another appointment for this year, for November, and they've cancelled it. What am I supposed to do?
What, that's a yearly appointment?
That was for the consultant, yes.
So yeah, but I mean, appointments a year apart. It sounds like that's a crazily long time to have to wait.
Well, that's the consultant.
No, I understand that. I understand. That's been cancelled as well.
It's been cancelled, and they've made an appointment for the December to see the nurse. So I'm not seeing the consultant in November.
Yeah.
What are people like me supposed to do?
What has gone wrong with it? Salma, what has gone wrong with it? It's just it's one story after another, like Sonia's.
Yeah, I do think that we need to look at what the backlog has been as a consequence of the pandemic and work out, actually, how are we going to start to unpick this? There are big strategy conversations that are happening at NHS England about where the pressures are coming from. And a lot of it is down to our own poor personal health as well, on top of acute situations like Parkinson's that we've just heard about from Sonia. So actually, there are a multitude of things that we actually need to focus on. And the biggest thing that is putting pressure on the NHS system entirely and creating poor health outcomes is obesity. And, we keep trying to tackle things like that, but we are unable to do it for various reasons. And actually, those people who are suffering acute illnesses, who are getting terminal illnesses like cancers and things like that, they're actually... they're being sort of deprived because actually the nation's health in general is very poor.
I can't, if this can't be the fault of people who are overweight that we've got a crumbling NHS, or maybe it is.
Yeah, so if you go back and look at a lot of what the NHS is saying about the acute illnesses, well, not the acute, the illnesses that come up over a long period of time, our poor diet and our health, our general health, has a lot to do with it. It's why the Treasury's tried so hard to improve that.
More calls after the break. Is it OK for family doctors to protect us by seeing fewer patients? 020 7862 2222, and we'll see you shortly. Now, more calls on GPs saying they can bring the NHS to a standstill by halving the amount of patients they see. It does mean that if you manage to get an appointment, you will be in there for twice as long. That's the one upside. So do get in touch. Linda's in Lancashire. Hi, Linda in Lancashire.
No, I don't agree with these doctors taking action, because if they do that, they're going to put more pressure on the hospitals and that because the hospitals are in a state now, aren't they? And that I've been waiting now nearly 2 weeks for an appointment to see a GP.
Oh, what are you going in for?
I'm a diabetic, and I've been having blackouts and everything and that, and I have high blood pressure and that. And last Thursday, I ended up in hospital for 4 days.
Right, because they've got to see. What are they going to adjust your medication, or they're going to put you on a Ozempic or something, or what do you think?
What they're going to do with me diabetic, they're going to put me on injections and now and that.
Yeah.
And I've got to wait to see another doctor about me blood pressure and everything and that.
Well, Marina, I hate to put you on the spot here, but you think the GPs are justified, so you've got to explain that to Linda.
Look, I think it's going to be catastrophic, but I hope it doesn't get to that. I hope it doesn't get to that stage. I hope West Streeting, brings them to the negotiating table before this industrial action kicks in on Thursday. I do think it's leverage, and I do think the fact that we are so this is how crucial they are to us, right? That they can just bring the NHS to a standstill. But I do think things need to be addressed. It's not just this funding, it's also the additional roles reimbursement scheme, where GPs aren't actually free to employ the people they need to with the funding that they've got. For example, if they want to employ additional practice nurses or additional salaried GPs, they can't. And this is part of what they're protesting against.
Because they can't get the money reimbursed. Linda, do you have any sympathy with the GPs or not? You think they should crack on?
No, I think they should crack on, because you can't get appointment now and everything and that. So if they do that, I just think they're going to put more pressure on these hospitals and everything and that.
Yeah, because you're right.
If you can't get an appointment to see a GP,
yeah, you might end up in A&E.
Now, that's why half of these people are going to A&E.
I know.
They're putting more pressure on the hospitals, aren't they? Because half of these GPs, they only work about 3 or 4 days. They do.
Well, yeah, there are lots of part-time GPs in that for family reasons and stuff. Linda, thank you so much, and I hope you get it sorted, and I hope you see your GP. Norman in Cheshire, hello.
Hello.
What do you think?
Do you know what percentage of the national health budget goes to the GP service?
Tell me.
Yes.
Oh, OK. The GP service, 10%.
How much of the national health budget goes to run that service?
10%.
No.
Oh, we're just going to keep going. OK, Salma.
5%.
No. You're halfway between the two. It's 7.5%.
Well, we did pretty well. Yeah? We going to get any credit for that?
No, 7.5%. OK.
7.5% goes. That seems to be a ridiculous amount for the gateway to the National Health Service.
Well, they haven't got big scanners in there, have they? In the end, it's about a human being who's very well trained, looking you in the eye and doing the Columbo and saying one more question and working out what you've got. And it's probably to do with gear, isn't it? They don't have a lot of gear in there.
Well, maybe they should have more.
Well, X-rays?
Well, not necessarily X-rays, but doing small operations, because as the lady before said, the A&E is full of people who can't get an appointment at their own doctor.
I know, and it's. I mean, there was a story, it breaks my heart, of a young woman. She's one of twins. She might have been Polish, I'm not sure, Eastern European. In their brain, as it happens, a bleed on the brain. 7 hours. They think it's just a headache. She dies while under her coat, waiting to be called. And they go in and they call her twice and they think she's gone because she doesn't respond. She's not responding because she's dead.
Oh, my gosh.
So A&E is a shambles as well.
GPs are also doing this because they care so much and they're so demoralised. Not only are they always vilified in the press, right, but they've been given all these targets and they're always been told that they're, lazy, they work 3 days a week and they're greedy. But actually, and I know this from personal experience, I've spoken to my GP before who said, over the phone, said to me, with a heavy heart, can I tell you, if you have private medical insurance, please go down that route because I won't be able to help you. And thankfully I have it with my work. But for the people that don't, they're just in that system. And that is, for a doctor who goes into that profession because they want to help, it's vocational, that must be tough for them.
Yeah, for sure. Thank you, Norman. Good quiz. Anne in Hertfordshire, hi.
Yeah, hi, good morning.
Hi. GP strike justified?
No. I'm sick and tired of the doctors phoning me up and me talking to them over the phone with what's wrong with me, and they tell me to send a picture in. I'm not going to send a picture in because that's not what people do. Also, last year we had flu jabs and we had to go to a school car park, sit in our cars under our windows, have the needle put in our arm and drive off.
That sounds efficient to me. What, they just jab you through the window?
The germs that are in the air.
I've never heard of that. Well, why is that? There's no COVID then. What was going on there?
I don't know. The germs that must have been in that school playground.
But jabbing people through the car window.
Yes. Yeah. I'm not seeing if they were.
Is that a Tory policy, Salma?
A drive-through jab?
Yeah.
I don't know, but it does sound like it could potentially be efficient if that's the new way of doing it.
But why? And why do you have to go and see your GP? Why can't you just send them a photo of the part of your body that's hurting?
Because I've got skin grafts on my body because I was badly burnt in a house fire.
Right. Well, that's a good answer.
So they need to see the skin graft to see the damage to the skin graft. Do I need to go to hospital?
Totally.
Or do they need to look at it?
Totally. So you're saying, look, your skin grafts are hurting and they need attention, and the doctor says, send me a photo. I can see why that would be annoying, Marina.
Yeah, I can. A photo's not going to work for all instances. No. But for me, for example, when the kids have got a rash or whatever, it works perfectly.
Does it? Okay. Have you had some attention now, Anne, or not?
No, I've got to wait 12 weeks.
12 weeks?
12 weeks.
Oh, this is just falling apart.
It is. It's fallen apart.
It's gone, and it's. Look, I know you'll say it was the Conservatives. You'll say it wasn't the Conservatives. It's probably having 65 million people on one tiny island and saying we're going to treat every single tooth in the country. We're going to treat every foot, every hand, every eye. It's not possible. Sorry. Thomas in Belfast. Hi.
Hi, Jeremy.
We're getting a bit miserable here, I must say. Hey, thank you.
The doctors deserve all the money they get. They're under incredible stress. They've studied for 5 years to become an ordinary doctor, and then another 3 years or so to become a GP. And the paperwork is one of the things that demoralises them. I have a daughter-in-law who's a GP in the south of England, and she works officially 3.5 days as a GP because she spends the other 1.5 days unpaid doing her paperwork. And I've had my 3 sisters, where I had 2 doctors and a radiographer, and I've seen what they've gone through, and I've seen the abuse they get and the pressure they're put under. But let me give you an example of a stupid paperwork. They have these people who have got targets now. And one of my sister's surgeries, they came out to investigate because too many people were dying, according to the statistics. It turned out her surgery was in an older established area with a lot of elderly people. Yeah. So she was fine. They were able to see that. Yeah. Then they went up to the next surgery further into the East Belfast, where there weren't enough people dying according to the statistics, and they wanted to find out why. Yeah. It turned out that was a brand new build with lots of young professionals and new children.
All right, Thomas, thank you.